Welcome, everyone. My name is Pam, and I'll be your conference operator for today's national audio conference titled Webinar, Don't Get Racked by New Medicare Audits. At this time, all participants are in listen-only mode. Later, we will conduct a question-and-answer session, and instructions on how to participate will follow at that time. As a reminder, this call is being recorded and will be made available for purchase on audio CD, print, and electronic transcript. I would like now to introduce your speaker for today, Wayne J. Miller. Wayne Miller, Esquire, is a founding partner of the Compliance Law Group, Los Angeles, a law firm focused on healthcare industry legal compliance for clients nationwide. Wayne has practiced healthcare business and regulatory law throughout his 25-year career. Mr. Miller has extensive experience in evaluating and addressing fair market value concerns as they relate to fraud and abuse and Stark law compliance. His firm represents a wide range of healthcare industry clients throughout the nation. Mr. Miller is a frequent speaker for the Coding Institute National Teleconferences on healthcare reimbursement, transactional, and regulatory issues. Mr. Miller, welcome to the program, and we are now ready to begin.
Well, thank you very much, Pam, for that nice introduction, and good morning or good afternoon, depending where you are out there in listening land. Today, as you know, we're coming to you not only by phone but on your computer, and it's a thrill to be able to present to you through GoToWebinar. As Pam indicated, our topic today is about an acronym that keeps being used in terrible puns, the RAC, or Recovery Audit Contractor Program. And we're really focused today because I know there's a number of different programs out there on this topic, but we're focused really today on sort of getting ready for it, and not only that, but primarily some of the thoughts, some of the thinking going into how one might appeal or respond to an audit if you become a subject of a RAC audit. All we have to do is look at the news, and all we're talking about nowadays, it seems like, is healthcare reform, healthcare issues. It's constantly in the news nowadays. And although we don't hear as much about the RAC program or Recovery Audit Contractor Program, it sure seems like this is going to be one cog, one component that is going to become very important to CMS and to the new administration as they move down the road of healthcare reform. We hear just as of this week, and we've heard even last week, of efforts by not only the industry to confirm that there's going to be restrictions on cost increases by the various players in healthcare, but also Congress itself is pushing through legislation to continue to add to the money to the enforcement side of CMS and Department of Health and Human Services, which would undoubtedly include more money for auditing contractors who are doing auditing and so forth. So this becomes a critical, I think, topic, and I think as much time as we can spend, we ought to spend in understanding what's going to happen and to help providers get ready for it. And really, from my perspective, in the same way that these contractors are standardizing or developing programs or developing forms and so forth that they're going to use, for multiple thousands of different providers, individual providers, I think, need to come up with their own standardized, as best as possible, standardized approach to how they respond and how they would appeal, and that even now, even before you even know what the issues are, you can really develop even basic appeal, basic response ideas that are probably going to find their way into any kind of response, any kind of appeal that you're going to be dealing with. And so now that we have a breather, because this program isn't fully implemented yet, and we have about 7 months before it is, this would be a good time to try to standardize as best as possible your approach, as well as the RAC contractors doing it on their end. I'm going to keep track in terms of my presentation by slide, and as you watch this on the webinar, we'll try to keep the slides in sync with my comments, and I'll let you know where we are as we go along. Slide 2 tells a little more about the presenter today. You've heard a little bit about our background from Pam. Certainly from our perspective, excuse me, our background in Medicare reimbursement, our experience in Medicare audits, this time is really an ideal time for even to have consultants or lawyers involved in part of that process that I've just mentioned of trying to standardize your own your own approach and to kind of be ready with your experts, ready with how you're going to respond, ready even with kind of having some idea of what the issues might be. And it's much better to get consultants involved at this point to help you be prepared and probably less costly than when we get involved at, let's say, a higher level of appeal like the ALJ level and so forth, when it does become more of a contest, more of a expensive, time-consuming process. So we encourage people out there to be thinking about this, and if they're thinking about these issues, to involve counsel or consultants early on. On slide 3, our agenda for today, we're going to try to cover a bit in this hour presentation. First of all, get a little history and where we are now in terms of the RACT program, the Recovery Audit Contractor Program. What is different about it? What we call the facets of implementation. What now that it's going to become permanent and applied to the whole country, what are some things that have been changed that are supposedly going to make it a little easier for providers, a little more fair to providers? We'll talk specifically about beyond just kind of really substantive issues, because it's really hard to talk about substance without knowing really what the appeal issues are going to be, but to kind of look at, based on historically what the demonstration program did, where were the areas of focus of these audits from a physician perspective and possibly from other provider perspective, and maybe kind of think about what the future might hold in terms of focus. And our belief is that there may be a different focus than what we saw in terms of the prior results than what we may see in the future. We'll then talk a bit about some of these things that, sort of standardized approaches to appealing, to challenging a review, talk a bit about the appeal process